Talked for weeks about flattening the curve, and you have lived it. Staying home, washing your hands, keeping distant from family and friends. Now, take a look at where the cases are popping up in Oregon today. The numbers from the Oregon Health Authority show us where we are on the curve so far. The blue line represents the number of cases per day. The red shows the number of deaths per day. These are not projections. These are the actual numbers that bring us up to the present day.
And now take a look at two sets of projections from the Institute for Health Metrics and Evaluation. On the top, projections of the number of Oregon deaths per day, topping out at 11 at the end of April. And now see the projections on the bottom. They show half as many deaths per day, peaking much sooner. Fox 12's Simon Gutierrez took a closer look at what's behind those changes, and he joins us live now tonight from Northeast Portland with all of that for us. Simon?
To weigh in on those new numbers, they did urge some caution, but also said there are reasons for optimism.
The new modeling predicts a peak in daily deaths due to COVID-19 in Oregon on April 21st, with the state having enough available ICU beds and ventilators to meet peak demand.
I think the IHME modeling can give us a pretty good idea of what's happening broadly in Oregon and what's potentially going to happen. And I think that idea of seeing our maximum number of cases in the middle to end of April likely makes sense.
Dr. Dean Seidlinger is the state epidemiologist and medical officer. He says the model has some limitations and is more optimistic than the state's own model, but in other ways it's consistent with the overall pattern of cases in Oregon.
What we're seeing from looking at some data around traffic and other things, that people change their behavior, and that our cases haven't increased at a steep rate that was seen in some other states.
Junwei Chi, director of OSU's Center for Global Health, says Oregon has positioned itself to follow the path of Taiwan, where the virus has been largely contained.
So by the time when the daily new confirmed cases drop to single digit, that will be a sign that we have contained that very well.
But in terms of Oregonians getting back to their normal lives, that could still be several weeks or months down the road.
I think it's too soon for us to pick a date and to say, we're free and clear. What we know and what the modeling shows us is that what we're doing is working, and that we need to continue to do that in order to stop the spread of this disease.
And again, the state is predicting more overall cases and more ICU patients than that current model suggests. The state will have its own COVID-19 modeling numbers up on the Oregon Health Authority website in the next couple of days. Reporting live in Northeast Portland, Simon Gutierrez, Fox 12 Oregon.